This is Brent of the Brookbush Institute, and in this video we're going to go over manipulations or high velocity thrust techniques. I assume that if you're watching this video, you're watching it for educational purposes and that you are a licensed professional with high velocity thrust or manipulation techniques in your scope of practice. If you're not sure, check with your state board. Most physical therapists, chiropractors, and osteopaths, you're in the clear. I believe that ATCs, you can't do manipulations in the United States, although other countries. Again, check your scope. Of course, massage therapists and personal trainers, these are generally not within your scope. Of course, you could continue to watch these videos just for educational purposes, learn a little anatomy, learn a little biomechanics. If you're going to do these techniques, please make sure that you have a good rationale for putting your hands on a patient. This should be based on assessment, and if you're going to assess, I'm hoping that you'll assess, use these interventions, and reassess to ensure that you're getting the result that you're looking for and have good reason to continue using this technique. In this video, we're going to go over the thoracic pistol manipulation. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Now keep in mind, if I'm doing a thoracic manipulation, I'm basing it on more than passive accessory motion. I have subjective complaints. Maybe Yvette has shoulder pain. I've followed that up with some sort of movement exam like the overhead squat assessment. Maybe on the overhead squat assessment, I saw arms fall and scapular elevation. I like to have a continuous interval measure so that I can measure progress. Unfortunately, with the thoracic spine, goniometry doesn't work very well. It's not very reliable. So maybe you guys could look into some of those rotation tests and at least have some sort of visual indicator of pre and post intervention. And then the last thing we're going to rely on is actually our palpation skills. So the things I might want to palpate for here, of course, I could do my PAs with my piezoform hamate grip, like a central PA on the spinous process, and look for any stiff segments or painful segments. Painful segments might be a reason not to do manipulation, keep that in mind. But if I find some stiff segments, that might be a reason to do manipulation. And you know, as I'm doing these, all I'm doing, guys, is I'm taking a PA, and you can look up these mobilization videos. This is just a thoracic PA, taking it all the way to end range. Does it feel stiff to me? I can talk to Yvette. Hey, how does that feel, Yvette? Pressure, right? A lot of pressure. Generally in the thoracic spine, you have to push pretty hard. There's probably a lot of inherent stiffness in the thoracic spine just because of all the rib joints too, right? So there's a lot of connective tissue and a lot of joints throughout this segment of the torso. Any pain there? What I start to notice as I'm going through the spine here, guys, and I won't waste your time going through the whole thing, but as I go through this, I notice that she is real stiff in this area. So I'm going to want to take a mental note of this is where I feel increased stiffness. I could also check for like increased tissue density, right? That might be an indication of overactivity. And of course I could do some like general spring type testing rather than like a PA, just to see if I feel like anything in the ribs. Do I feel like, once again, this segment definitely feels different than like when I press down here. You okay? All right, now the pistol manipulation itself is face up. So we're gonna go ahead and have Yvette roll over. And then I'm gonna show you guys how to set this up the best way I can. This is definitely one of those techniques where people get caught up in the minutia and then they get all freaked out and then they stop thinking about just doing the technique, right? So scoot down a little bit more. One thing you guys wanna watch out for your own hands, right? Because what we're gonna do is make a fist underneath Yvette's back, is you don't want to be on seams, right? Or creases in your table. So I want to make sure that the portion I'm going to manipulate is on a nice, flat, seamless surface. The next thing I'm going to ask Yvette to do is I'm going to have her interlock her fingers like this and then put them at the base of her neck. Because what I'm going to use her arms for is controlling her torso. Now, I guarantee this is going to happen. Everybody is going to do this, so go ahead and show them, and then you're going to go put it on your neck, and they're going to go like this at the bottom of their head, and then they're going to lay down, and you're going to try to put their elbows together and squish their face. We don't want to squish faces. Besides, this is just not as easy to control. Sorry, Yvette, but I see it all the time. So again, right here, Right? So you guys, all I'm doing is interlocking, like my fingers go down to the edge of my other fingers, not crossing like this, and then go all the way down to the base of your neck. And now when I bring your elbows together, you miss your face. And of course I have good control over your torso. Notice her head comes with us. I can rotate away, which when I do this technique, I tend to do this way. I will show you guys the other method as well. Now, from here, what I want to do is I'm going to wrap one hand around forearm like this, and then you notice my wrist and my other forearm kind of keep her elbows together, pull away. I'm then going to take my fist and place it right over that stiff part of her spine. Now the goal is to put the segment that I want to manipulate just above my last knuckle. The reason this is called the pistol manip is you can do it this way, right? Like you're making a pistol with your hand, right? I like to do it this way, and it doesn't matter. All that matters is this is the last segment that you're bracing, and this segment right here is the one that gets manipped. We're in essence shearing one vertebrae over another. So, yeah, go ahead. She's stiff up in this area. I can feel for her spinous process. I'm going to put the spinous process right here, right between my thenar eminence and my IPs. I'm then going to just bring her over the top of my hand. Now, I have had many a patient with a nice setup like this who, as soon as I drop them back, I get a cavitation. Right? Again, setup is everything. So be comfortable. Make sure you have spinous process right here, stiff segment of the spine here. Make sure you're both comfortable. And what you're going to do is, as you're laying your hand down, it helps to push a little in this direction. I'm going to lay my chest kind of over my forearm here. Oh, more time of it.
Oh my God.
Sorry. I'm going to lay my chest over, and then all I'm going to do is have Yvette take a nice deep breath. And as she breathes out all the way to the end, I'm going to give a nice quick push. And that was it. In that particular case, I actually felt the vertebrae move, but there was no cavitation. Big thing to remember, guys. That is a successful manipulation. Cavitation does not mean success. Increase range of motion on assessment is success, and whether you get a cavitation or not, it doesn't really seem to matter. So now let me give you guys a couple tips going back through that. I have no problem with my hands creating this type of fist, putting her spine like this, or her spinous process like this, and pushing down. Some people don't like how that feels on their knuckles, so they do this thing. They either grab a pencil, or Yvette here was nice enough to lend me her lipstick, something I don't particularly carry on a regular basis, but I've seen people use chapstick. I'm only going to give you one bit of advice. Once you find something that works for you, keep it on you. Because if you get used to this and switch to this, I guarantee you're going to have a problem with your setup. If you get used to this and switch to this, same thing. If you get used to having something in your hands, going without anything in your hand is going to feel a little weird. The setup would be the same. Let's go ahead and have you. Right. The setup would be the same. I'd still put her spinous process between, but now I can feel like I can't crush my own knuckles. I do think in general this overcomplicates things. I don't think it's necessary for most individuals. I think people just get hooked on it in the beginning when they're learning this technique because they're not real comfortable with their setup. So they tend to spend a lot of time over the top of their knuckles. And then since they're spending a lot of time over the top of their knuckles, it gets really uncomfortable. Now, if you're not larger than the person that you happen to be working on, there is another way to do this, which is hand from the same side under. Now all of the same stuff would still apply. So let's go here. All right, she comes here. And then all I would do is turn her this way, right? So turn her away from me. I would take this hand, put it under her spine, and then flip her back. And the same technique applies, right? Now for me, this is a little uncomfortable because this is not the way I actually do this technique personally. But once you get set up, you can see how my fist is still in the same position. And now all I'm gonna do is push down this way, kind of in that direction again. It's a nice little clinical gem, guys. It's not straight down, it's go that way with your force, right? It'll work the same way. Last variation you guys might wanna try is I have seen this done this way, okay? I find it a little harder to control the torso this way, but if I was gonna do this, I could still grab her elbow, set myself up, and now I'm kind of like trying to figure out how to position my torso. I end up with a little bit more of like her, this part, kind of like here on my rib cage. But again, the setup's the same. This is just not as intense on the client's shoulders. I think all of this, once again, guys, is really dependent on whatever setup you get good at, do. I think it's great to experiment in the beginning, but then once you have a technique that you go to, I would just keep going to it, because I think a lot of the little, again, minutia of this hurts my knuckles, I can't reach my arm around, this hurts the patient's shoulders. What that's really a complaint of is it takes you a really long time to set up because you're not as well practiced as you should. Like if I do the pistol manip, let's go ahead and do the pistol manip one more time to review. Here, my clients get used to it. Great, I'm here. I know where I want to be. Ready? Nice deep breath. Good, and that was it. Right, so that took a few seconds. I'm not suggesting you do things in a hurry. What I'm suggesting is you practice enough that you can kind of go into a flow with this particular technique. Guys, stay tuned for your close-up recap. All right, guys, for the close-up recap, I'm gonna go ahead and have a vet change from this arm position. Although this arm position for some people is very comfortable, I'm gonna have you go ahead and do the little interlaced fingers at the back of the neck, right? Remember, we go to the base of the neck so that I'm not squishing her face. And then from here, I can use my hand over one forearm, and then I actually use my wrist on the other side of the other forearm so that I have control. And I'm gonna pull a vet a little further away than I normally would. Now, you could go the other way. Don't forget, guys, like whatever is your comfort zone, like whether you're gonna wrap around, you're gonna come from the same side, you're gonna do this arm position or the other arm position, just make sure you get comfortable. The technique is still the same. We're still gonna use our fist to go on either side of the spinous process and then shear the top vertebrae over the vertebrae we have stabilized. Right? So what I'm going to try to do is I'm going to feel her spinous process and try to put them right there. You know, this IP is going to be on one side, my thenar eminence on the other. I'm going to try to set this up. If you guys prefer this technique, then it would be to set this up as just below the segment that I want to manip. And then I'm going to pull her into as much flexion as I can, lock her out by going into flexion with cranial force at that segment. So you get this kind of combination of flexion with extension against your hand. Just going to pull up this way, feel those spinous process. There they are. All right, double check. All right, maybe it was a little farther. Be careful. It's real easy when you're not looking. I caught the end of the ribs there. Thought I was on the spinous process, double checked, and now I'm on the spinous process. So I'm going to get my hand wrapped around. Now my hand is there. Now keep in mind the direction of my force is more or less going to be in the direction that her forearms are currently in. All right, so if I just kind of follow the direction of her forearms, sorry, I need to reset. Follow the direction of her forearms, big deep breath. And that's it, guys. Take your time to get set up. Make sure you practice this often, and then whichever elbow setup you want, hand setup you want, whether you want to put a pencil or chapstick in there, whether you're going to wrap around or same side, just get used to it, practice it. If you have any questions, leave them below. A couple of points to recap. Knowing your anatomy and knowing your biomechanics will certainly help you choose the right technique for the right patient. If you're unsure whether manipulations are appropriate due to their higher intensity, it's okay to do mobilizations. Most research points to manipulations being slightly more effective, but mobilizations being very effective. And of course, we have those videos for you if you want to start with those less intense techniques. Make sure that if you are doing any technique that is based on assessment, and of course that you're reassessing, ensuring that the technique is effective for the patient that you're working on. And when it comes to all manual techniques, guys, manipulations, maybe more than any other, look for opportunities to get live education. Although I know videos are convenient and I'm happy to have these up for you guys to watch, it would be so much more helpful to use those videos as a recap of one-on-one attention with somebody who's experienced with manipulation techniques. At the very least, grab a colleague, grab a friend, and start practicing these before you bring them into clinic and start using them on patients and clients. I hope you enjoyed this video. If you have any questions, please leave them in the comments box below.